If you've gone to see an orthopedic doctor because of shoulder pain and they've told you that the best option is an injection, this video is exactly for you. Because before you say yes, there are 5 scientific facts you need to know that you most likely haven't been told. It's not that the injection is bad, it's that choosing it as the first option without having tried what science has been recommending for 20 years is a decision that will often cost you dearly. In pain, in function, and in long-term shoulder health. In 20 years in the clinic, have you seen hundreds of people with the same story? Shoulder discomfort that appears little by little. It's hard to comb your hair, hard to fasten your bra from behind, hard to sleep on the painful side. You go to the doctor, get an MRI, they tell you that you have tendinopathy or impingement or subacromial impingement, and they offer you an injection. And this is where the problem starts, because most people accept it without worrying. And with the 5 things I'm going to tell you, the way you make decisions changes radically. Let's go. However, before we start with the first fact, just one quick thing. If you're interested in this kind of content, if you're interested in improving your health through exercise, I send out a free weekly newsletter where I share the latest videos I've posted on my channel. To sign up, just click on the little card that appears up here, go to the link, leave your email, and that's it. Until next Sunday, when I send you the next newsletter. Let's start with the first point. The relief from an injection is short and modest. This is clearly stated by the Cochrane Review on corticosteroid injections for shoulder pain. They analyzed all the serious clinical trials available. All the evidence and conclusions are as follows. A corticosteroid injection into the subacromial space produces a small benefit in pain and function compared to placebo, it's small, and that benefit doesn't last beyond 3 to 6 weeks, and from then on the difference with doing nothing fades away. This doesn't mean it doesn't work. It means that if they present it to you as the solution that's going to fix your problem, the information is not correct. The injection offers temporary, short-lived relief, and it's often sold as if it were permanent, but it's not. Point number 2. Over a 12-month period, the injection doesn't provide more benefit than well-guided exercise. This is the most important fact, yet few people know it. It was published in 2021 in the Lancet Journal, which is one of the 3 most important medical journals in the world. In a study called GRASP, which is a multi-center clinical trial with more than 700 patients with shoulder pain due to rotator cuff problems, which is the most common cause of non-traumatic shoulder pain. They compared 4 groups: progressive exercise with injection, progressive exercise without injection, standard advice with injection, and standard advice without injection. They kept them in the study and followed them for a whole year, measuring pain and function and how well the shoulder moved. What were the results? At 12 months, there were no significant differences between having received the injection or not. The injection provided a small relief at 8 weeks, and that was it. From that point on, all the groups progressed similarly. Translated into plain language, if you follow a good exercise program, or even just get good advice, after 12 months, you'll be the same with or without the injection. The difference comes from what you do with your shoulder every day, not the needle they stick in your skin. Point number 3. Repeated injections harm the tendon. This is the point that's communicated the least, and the one that worries those of us who've spent years seeing patients the most. The cortisone used in the injection has local effects on the nearby structures, and when it's repeated, those effects accumulate. Research has shown for years that repeated exposure to corticosteroids in a tendon is associated with weakening of the tendon fibers, reduced repair capacity, and in some studies, a higher risk of rupture. In the shoulder, this has very specific implications. The rotator cuff is a group of tendons that are already prone to degeneration over the years. If you add 2, 3, or 4 injections over a lifetime to that natural degeneration, you're playing with fire. Many of the rotator cuff tears I've seen in older people are preceded by a history of repeated injections. And then the surgery doesn't go as well as it could have if there hadn't been so many interventions, if there hadn't been so many injections. The injected tendon is less able to heal. That's why modern clinical guidelines are very clear about this. At most, a single injection during an acute episode, and always accompanied by serious rehabilitation. No injecting every 6 months just because the pain comes back. Point number 4. The injection treats the symptom, not the cause. This is the main thing I want you to remember. Shoulder pain usually doesn't occur randomly. It's typically caused by an imbalance of forces. Because the rotator cuff is weak, because the scapular muscles aren't supporting it, because daily posture puts strain on that area, because the shoulder is asking for movement and relief that it's not getting. When they give you an injection, all of that stays the same. Cortisone reduces local inflammation, numbs the pain, and gives you a few weeks of relief, but the cause is still there. And when the effect wears off, the pain comes back, sometimes even worse, because during those weeks of relief, you pushed your shoulder thinking it was healing, that it was already fine, when in reality, it was just numb. Exercise does the opposite. It strengthens the rotator cuff, works the stabilizing muscles of the scapula, teaches proper movement, changes the relationship of your shoulder with gravity and with loads, and that's actually addressing the cause. That's why, after a year of follow-up, exercise outperforms injections, because when the chemical effect of the injection wears off, the only thing left is what you've built with your shoulder. And here's something that is very rarely explained well. Exercise doesn't work just because it builds muscle. It works because it changes how your nervous system interprets the load on your shoulder. When you've spent weeks doing movements that used to scare you, your brain gradually lowers the alarm, and that lowered alarm means pain relief. That's what modern science calls recalibration of the system. And there's no cortisone in the world that can do that. Cortisone just turns off the pain signal for a while. Cortisone turns off the pain signal for a while, but properly prescribed exercise teaches your brain that the signal is no longer needed. Point number 5.
Punto número 5.
The rule I use in my practice, and that I suggest you apply before agreeing to a shoulder injection, is to try at least 8 to 12 weeks of serious rehabilitation first. Not a generic exercise routine where you keep doing the same exercises at the same level of difficulty. What we're looking for is progression tailored to your symptoms, focusing on the 3 most important pillars: mobility, strength, and stability. All of that mixed with pain education, which is what we're looking at here. And I'm going to give you a very simple sign to recognize if a rehabilitation program is good or not. In a good program, the weight, the intensity, and the exercises change at least every week. If you've been doing the same exercises with the same resistance for 2 months, you're not rehabilitating, you're just maintaining. Rehabilitation is about progress. That's the pattern you need to follow when improving your shoulder. If after those 8 to 12 weeks of proper rehab the pain persists and limits your life, then yes, a targeted injection as a bridge to better rehabilitation is a reasonable option. Never before, never as a first option, never as a substitute for exercise. And if a professional offers you the injection without having talked to you about exercise first, you have the right to ask why. And I'm going to give you 3 specific questions you can ask during the consultation if they suggest an injection. Number 1. How long do you estimate the relief from this injection will last? If the answer is more than 3 months, be careful, because science says 3 to 6. The Second, what is the likelihood that the injection will need to be repeated? If the answer is high, that tells you the injection is not addressing the cause. The third question, what has been tried before in terms of exercise? Should I do exercise and rehabilitation for my shoulder first? If the answer is no or it's not necessary. Obviously, in this video you have all the information you need to ask to postpone that injection and start trying exercise first. In fact, I'm going to put a little card right here in the upper right corner of the screen with a really good video where you'll find progressive exercises to improve your rotator cuff. None of these questions are aggressive. They're the ones that science itself suggests you ask, and an up-to-date professional will answer them for you without any problem. And here you have the 5 points we've talked about very condensed. It only provides short and modest relief for 3 to 6 weeks. At 12 months, it doesn't provide more benefit than properly done exercise. If done repeatedly, they can damage the tendon. They only treat the symptom, not the cause. And remember to use the injection as a second or third treatment option, always after 8 to 12 weeks of rehabilitation through exercise. With these 5 facts in hand, the next time the word injection comes up during your appointment, you won't just accept it by default, you'll put it into context. And one last idea I want to leave you with. Science is not against injections. It's against using them as the first option and as the only solution. The shoulders that have the best long-term outcomes are those of people who learn to progressively move weight and take care of their joints. And if you've enjoyed all this content, let me remind you that every week I send an email with information like this, including exercises to take care of your health, straight to your inbox completely free. To sign up, you have the link down here in the video description or in the first comment. Just click the link, enter your email, and you're signed up. We send the email today, Sunday, and on Monday. That's all. I'm genuinely happy you stayed with me until the end of the video. I sincerely hope that all of this has helped you open your mind a little and ask yourself the right questions, and above all, I hope to see you very soon in one of my other videos.